Welcome to ASRS's Journal of VitreoRetinal Diseases Authors Forum. I'm your host, Dr. Timothy Murray, Editor-in-Chief of JVRD. On each episode of the JVRD Authors Forum, I will interview innovative retinal researchers on their studies featured only in JVRD and how these studies will impact our patients' care in our clinics. Tune in to hear directly from investigators about the clinical implications of the newest and highest quality research in the field of retina. Welcome. I'm Dr. Timothy Murray, Editor-in-Chief for the JVRD Journal of the American Society of Retina Specialists. It's my pleasure to be joined at our Authors Forum podcast by Dr. Jennifer Lim, Director of the Retina Service at the University of Illinois at Chicago. Jennifer is the past president of the Retina Society, is on the AAOI Wiki as the deputy editor-in-chief, and is a counselor for UIC for the AOA. Jenny, thank you for joining us to speak on the influence of ultra-widefield fluorescein angiography on the diagnosis and management of diabetic retinopathy. Dr. Lim.
Thanks so much, Tim. It's really a pleasure to be here with you today.
So, this is such an interesting topic, I think, for you and I, and for our colleagues in general. Our specialty is so imaging focused, and I think that we all believe that we want to see more and more of the structure of the eye. Can you tell me what prompted you and your team to do the study for this article?
We were curious to see whether the peripheral lesions that we can see even on color fundus photographs or on fluorescein angiography could actually influence the decisions that we would make in terms of how would we treat the patient or even just diagnosing the patient. Because as you know, all of the stuff that we use to grade diabetic retinopathy is really based on the ETDRS. And the ETDRS are only those 7 fields that are rather posterior. And yet the vast majority of the retina is not included there. And historically, the founding fathers, if you will, that put together the Early House said that, the peripheral lesions are really important, but they didn't have the technology back then to include it. And that's why we ended up with these 35-degree 7-field fundus photographs. And so we said, let's look, let's see if what they saw in Protocol AA actually makes a difference in how we diagnose and manage our patients.
Now, giving credit back to the founding fathers, they were big believers in direct ophthalmoscopy, and the examination played a pivotal role in their care of their patients. I think we've got a little spoiled as we've moved into these imaging technologies that really let us see areas that were only visible with indirect ophthalmoscopy in the past.
Absolutely. And I think it's really important because, as you know, when we see a patient, we don't just look posteriorly, we take in the whole retina. And probably, I don't know about you, Tim, but when I was younger and I was doing this, I actually looked at all of the lesions when I graded the retina because it didn't really sink in that I'm only supposed to be looking at those posterior fields.
So how did you elect to look at this from a study design perspective? How are you going to evaluate this?
So we said, let's go ahead and put together some data sets on patients who are really easy to image that have non-proliferative diabetic retinopathy all the way up to proliferative diabetic retinopathy. Let's take a wide field fundus photograph and a red-free image. Let's give that to some experts and let's see how they grade it, how confident they are in the grade, and what would be their management decision. Then let's take those same patients and add in ultra-wide field angiography, and then show the same people these lesions that are ultra-wide field fluorescein angiograms and see, is there a difference in terms of how they diagnose the patient in terms of the grade, and then does it change their management? So we put together all these sets and we showed them at random order to the experts.
Perfect. So how did you pick your experts? And this seems to be very similar to work that was done in ROP standardization for wide field. And it looks like that feeds a little bit into the same type of evaluation process.
Absolutely, Tim. As always, you hit the nail on the head. And this is exactly what was done in ROP. And the brainchild of this project, this was Paul Chan's project. He said, let's see, we did this for ROP, let's do it for diabetic retinopathy. So he picked the experts based on people who have published at least 2 diabetic retinopathy articles or who are participating in DRCR and who are recognized people who take care of diabetic patients every single day. And you can see this came from a variety of institutions around the country. And I must say, Paul picked his friends and colleagues.
No, that can't be true. You pick your friends? Okay. All right. So
Or
so
people,
take us
sorry, or he
go
picked
ahead.
people who'd get the job done. So,
Oh, his friends that actually will do the job. That must be why I didn't get a call.
oh, I don't know, Tim. I think you got left out by accident.
So the idea here then is to look at how a new wide field fluorescein technology influences the decision point for diagnosis and potential treatment. So tell us what you found.
So, really interestingly, we asked people, first of all, how confident are you once you make your diagnosis? And then also at the start, it was like, do you think fluorescein angiography is needed? Do you think it's going to change? So, we all went ahead and graded the images. And then we graded them again with the angiography. And lo and behold, what did we find? We actually found that the sensitivity, that is the correct diagnosis, the presence of PDR or severe NPDR or moderate NPDR, was significantly improved when fluorescein angiography wide field was used compared to the wide field colored fundus photograph. In fact, the diagnostic accuracy increased from about like 35% on the low end all the way up to 68%.
But did that really surprise you? I mean, or was that more confirmatory to what your bias was with the start of the study?
I think that part we probably if we were honest, we would have said, yeah, probably we'd pick up more NVE that we really didn't maybe pick up on the color, but we didn't think it would be that big of a difference. So I was quite surprised that it was a doubling in terms of the sensitivity. And then on top of that, I was also surprised that the confidence also doubled. So more people were very confident of their diagnosis. And in fact, in addition to that, the inter-observer concordance also increased when fluorescein angiography was included. And lastly, the treatment decision changed in 43%. So that's a huge percent change.
That's really, I think, the most critical part of this. It's always great to see the impact of an influence of advanced imaging, but I think most of us would have argued if it doesn't change what you need to do, then where's the risk and benefit here? But you saw significant shifts in what the recommendation to treatment would be.
Absolutely. It passed the so what test,
Yeah,
basically.
exactly.
Yeah. And so, I think in an ideal world, we should really get these angiograms on our patients. Now, of course, we have to take into account the caveat that this was based solely on the pictures, right? We didn't actually do the exam. And in real life, we would be examining the patient. But then again, as you and I know, Tim, the color fundus photographs capture the diabetic retinopathy better in study after study compared to somebody just looking at the retina.
And I think one of the things when we're talking about advanced imaging technology is the downside to fluorescein, of course, is the intravenous injection of the fluorescein dye and potential risk and access issues and concerns. I think you and I both have been intrigued by wide field OCTA, which you look at and think, is that going to allow us to have an effective wide field vascular pattern without requiring any invasive component of testing? I know that wasn't what you addressed here, but you've also been an expert on that type of technology. What are your thoughts on that?
I think that's an excellent point, Tim. And I really do believe that wide field OCTA is going to make a difference. We've already done a lot of studies in diabetic retinopathy as well as sickle cell retinopathy. And we've shown that the OCTA can be very helpful in diagnosing patients and also in prognosis, right? And we can even look at the amount of capillary dropout and amount of non-perfusion. And as you know, the wide field images, therefore, can give us a lot more information there. And sometimes the OCTA can actually even be better in looking at the capillary levels because you don't get the spread of the fluorescein as you do in angiography. So I think it's going to be very exciting to see what happens in the future.
And people argue about the fact you don't have flow dynamics in OCTA and you really want to look at flow characteristics. I think we're going to try to find a mix of risk and benefit for technology. The other thing that I think is interesting is, where do you imagine AI may come to play a role in this kind of approach to our patients?
I think AI, when we look at it in terms of the non-perfusion and doing these parameters, doing quantitative OCTA analysis, can really help in the prognosis of these patients and give us more granularity to help us give a more individualized level of progression. And then on top of that, as you know, Tim, we've seen this in some of our meetings, they can use AI looking at the color, looking at the OCT, and they can create synthetic angiograms, which blows my mind.
No, me
Yeah,
too.
so I think, putting it all together will really be a very, very strong predictive package for our patients in order to determine what the retinopathy levels are and how they're going to develop going.
Exactly, but you have to have the imaging technology first. So I think this was an excellent validation for our understanding of ultra-widefield FA, at least in the realm of diabetic retinopathy. So thank you for an excellent paper. You guys did a beautiful job. Thank you for articulating so well tonight what that paper's impact potentially will be. And thank you for joining us, Dr. Jenny Lim from University of Illinois at Chicago.
You're very welcome, Dr. Murray, and thank you so much for asking such salient questions and always hitting the target right on the head. So thank you so much. It's a pleasure to be here.
Thanks for tuning in to the JVRD Authors Forum. You can watch and listen to more episodes on the ASRS YouTube channel and on popular podcast directories, including Apple Podcasts and Spotify. Visit www.asrs.org/JVRD forum on the ASRS website to learn more. See you soon.